Hey guys, it's Lexi, and in this video I'm going to be talking about some factors to consider when trying to decide which endodontic residency programs to apply to. So one of the first things you're going to want to consider when deciding where to apply is going to be the requirements for that specific program. And so you want to consider if the program requires the ADAT or if it has a specific class rank or GPA requirement, which sometimes you can see on a website for some of the programs they have it. And then also some programs are going to want you to have prior work experience as a general dentist. And so that means that if you're applying straight out of dental school, there are certain programs that won't even consider you. The same goes for those programs that strongly prefer a GPR experience or require a GPR experience. And then the other thing to consider is some programs have their own application, whereas other programs are going to let you apply through PASS. So this isn't something to stop you from applying to a program with its own application, but just make sure that that's something you're aware of because those separate applications can be very time consuming. The next factor to consider is going to be the length of the program. Endodontic programs vary in how long they are, but typically it's going to range from anywhere from 2 years to 3 years, but some programs are going to be somewhere in the middle at like 26 months, for example. So just make sure that you're aware of the duration of the program when you're applying. Another factor, of course, is going to be the cost of the program, and programs can range from the program paying you to you having to pay a substantial amount of money to the program. And the schools that have no tuition and provide stipends tend to be schools that prefer applicants with more experience, which makes sense because essentially they're paying you, so they want you to be able to produce. But also those programs tend to be more competitive for the reason that they're not as expensive or they're even free. And in some cases, you can even make a profit from the program. Another thing is you want to make sure that if you're trying to figure out the cost of a program, that you go directly to that program's website. So you might notice that there's a list of all of the endodontic programs in the country listed on the AAE website. However, the cost estimations are oftentimes inaccurate. So just make sure you're verifying the cost on the program's website directly. The next factor to consider is going to be location. And so for a lot of people, that's going to mean proximity to home. And so if you're from the United States and you have family somewhere, you want to stay close to them, that can oftentimes determine where you apply geographically. Another thing to think about is the actual city that you would be going to. Is it a small or is it a larger city? You can think about the weather and then also about how safe it would be to live there. And then for other people, if you have kids or a family, you could consider the school district and many other factors related to location. And then in terms of actually treatment in that specific city, you can think about the patient population. And then that can range anywhere from the languages that are most spoken to the diversity that exists. And then also you can think about if Medicaid covers root canals in that area, which can sometimes help because then you have more patients that are going to choose to proceed with root canal treatment. Another variable to consider is the class size. So you may want to look at the number of residents that are admitted to the program each cycle. And then another consideration is if you want to go to a school-based versus a hospital-based program. And while the vast majority of programs are going to be in a dental school setting, there are a few that are hospital-based. And for those programs, they oftentimes require that you have prior work experience as a general dentist, or they strongly prefer that you have GPR experience. You then want to consider whether or not you're going to be getting a master's degree from whatever program you're applying to. And while some endodontic residency programs provide the master's degree, others don't. And typically 3-year programs are going to include the master's degree, whereas for 2-year programs, they'll sometimes make it optional where you can complete an additional year in order to get the master's. And then there are other programs that are just 26 months and you can get a master's degree just like that. So it really just depends, and you want to make sure that that's something you investigate if you're interested in getting a master's degree or if that's something that's important to you. And in terms of whether or not it matters to get a master's degree, I tried asking a lot of faculty about this, and the consensus seems to be that it can matter if it's something that's important to you in terms of like you just want the additional degree, and then it can also be important if you want to work in academia or research in the future. In terms of if you just want to go into private practice, it isn't necessarily going to be essential that you have a master's degree. It honestly just boils down to what is going to be a priority for you. And then another factor to think about is if you want to pursue board certification. Some endodontic residency programs are really going to place a large emphasis on board certification, and consequently consequently, they're going to prepare you to take the oral exam and the written exam, and it might increase the likelihood that you actually are able to become board certified if you go to a program that really emphasizes it. Whereas other programs, it's not really considered a big deal whether or not you pursue board certification. And then there are even some programs that have a very strong expectation where they'll just tell you that they do expect you to pursue board certification. And it's not like you have to sign anything, but it's more just like a verbal commitment that you kind of agree you're going to try to pursue board certification after the program's over. And then another thing to think about is going to be the program director and endodontic faculty at the program. And these are really the people you're going to be interacting with every day, and they're going to help set the tone for the program. So it's important that you get along with them and that you enjoy being around them and they enjoy being around you. So in order to get to know program directors, you could consider going to different endodontic conferences. So the main one to consider is the AAE conference every year, but you can also, like if it's too late and you're applying this cycle, you could even reach out to specific programs to see if you can visit and try to get to know the program directors and faculty that way. And then sometimes it's also important to be aware if a program is in the process of transitioning from one program director to another. Another factor to consider is if the program is considered research or clinically focused. And while every program is going to have some amount of research and clinical experience, the balance may differ. And some programs are known as being strong clinical programs, whereas other programs tend to focus on research. And for those programs that focus on research, you can expect to dedicate a larger portion of your time to conducting a research project. Although you should be aware that every program, at least that I'm aware of, is still going to make you do some amount of research. It's just that some programs, it's going to take up a larger portion of your time or something that they emphasize more. And then some programs are going to have a greater focus instead on the number of cases that you do clinically. And so depending on what your career goals are, whether that be in academia or private practice, and then also how important it is to you to have that research component and how strong of a research component you're looking for can help you to kind of decide between different programs. And then going off of what I said on the last slide, you'll also want to look at the number of cases of both surgical and non-surgical root canal therapy that is completed by a typical graduate of that program. And that can range anywhere from 150 cases at one school to 450 at another for non-surgical root canal treatment. And so just make sure that, while most schools are going to be somewhere in the middle, you're aware of the number of surgical cases that you can expect to do as well as non-surgical cases so that you're not taken off guard after you've actually started the program. And then some other cases that you might consider would be implants. Certain programs are going to allow you to place implants, whereas others you don't really place implants. And then also exposure to trauma cases. So you want to consider if you're going to have trauma cases, whether that's going to be when you're on call or if you go to a hospital. Another thing I didn't put on here could also be doing root canal treatment under sedation. So will you have the opportunity to go to the hospital and do cases like that? Or if they have nitrous or not. So those are just little things that may or may not be important to you depending on where you see yourself practicing in the future. And then going off that, you might want to know how often and when you're going to be on call for emergencies, and if that's going to be something that you'll have to do in certain evenings or only during the daytime. And then also if you're going to, like I said before, perform any procedures in a hospital setting. And then another factor to think about is the access to technology. And so while every program is going to provide you with microscopes or allow you to purchase microscopes, you might be interested in the type of microscope that a program uses, or if you're going to be able to try out multiple different types of microscopes. And then also if a program has gentle wave and how many gentle wave systems they have available to you, what kind of file systems they use, and maybe how open the program director is if residents are interested in trying new materials or different file systems, if the program is accommodating toward that or not. And then if you consider CBCT scanners, that's also something that you're going to have access to a certain extent at every program. However, for some programs, the endodontic department will have their own CBCT scanner, whereas for other programs, they'll have to share the CBCT with other departments. And so that might mean that they're not using it as often, or it could be more difficult to access. And then the last factor that you can think about is whether or not the program provides assistance for you. At some programs, those are going to be professionally trained assistants, or they could be dental students that are assisting you. And then for other programs, programs you're going to be working alone. You might not have a chairside assistant, but you might have someone else there if you need IRM or Fuji, whereas for other programs there are just no assistance whatsoever or very limited assistance, and so that's something you can ask about as well. Thanks for watching. If you have any questions, feel free to leave them in the comments below. If you enjoyed the video, make sure to give it a thumbs up, subscribe, and also hit the notification bells so that you can stay up to date when I upload new videos.